Hi, everyone. This is Dr. Michael Gold from Nashville, Tennessee, and this talk is really something different. It's really about a new peeling category, a new way to take care of your patients with a topical routine, and I want to show you what we're able to do. So I am from Nashville, and for conflict of interest, I am working with a company called Wyco. They're based in Trieste, Italy. They have an office now in the U.S. That they're doing some things with, but the Trieste, Italy, if you've never been, is on the upper left corner of Italy, and it's the home of the first coffee shop in the world, Italy Coffee. I've been there many years ago, and if you ever get to Trieste, that's a treat and a half. So what I'm going to talk to you about is effortless transformation of your skin. And you see here PRX-T33. And this is the product that I'm going to talk about, and we're in the final part of a very large clinical trial with this, looking at its effect on the skin. So what you see is it's TCA, hydrogen peroxide, and kojic acid, perfect intense liquid for skin beautifying and promoting attractiveness of the skin. So again, this is out of a company that's started in Trieste, Italy. Their main headquarters now is in Milan. Their R&D is in Trieste. Again, the products are around the world, basically, learning how to use this, expanding the technology, effortless transformation. So it is a patented key ingredient in a revolutionary non-invasive skincare protocol, which provides immediate skin, what we call beautification, with minimal downtime. This formula has been refined over the years and is covered by an international patent. As I said, this is truly different and truly unique. The beauty of this product is an effective modulation of its main ingredients of low concentration hydrogen peroxide and trichloroacetic acid to provide deep hydration and non-invasive dermal care. So the hydrogen peroxide, which we all call their little secret, it's revolutionary in its insight. So the biological effects of hydrogen peroxide is directly proportional to its local tissue concentration. So there's a low concentration of 0.1 to 0.3%, and there's a high concentration that we know about, which is 3 to 5%. So what is the difference? So hydrogen peroxide effect on tissue regeneration. At low concentration, 0.1 to 0.3, we see a promotion of the effects of tissue regeneration, where at high concentrations of hydrogen peroxide, we see an inhibition of tissue regeneration. So again, most of us have never really thought about what low concentrations of hydrogen peroxide can do on the skin and for the skin. So why does hydrogen peroxide work in low concentrations? So skin layers already contain naturally occurring endogenous hydrogen peroxide in low concentration. It acts on tissue receptors to facilitate repair, regeneration, and remodeling of the extracellular matrix. We also know that low concentrations of hydrogen peroxide modulate inflammation. It enhances the expression of VEGF and of its receptor, easing the start of angiogenesis, and it takes part in the remodeling of the extracellular matrix thanks to what is a controlled apoptosis. And we know this about this. So again, the products in this formulation that we're putting on the skin is TCA 33%. It is a low concentration of hydrogen peroxide and kojic acid, 5%. So TCA, why TCA and why 33%? Well, TCA is well studied and predictable. It gets us where we need to go. We've been using TCA. You started using TCA when I was a first-day resident. So TCA has been around for a long time. If you have superficial exfoliation, we're not looking for that. We want 30 to 35% to be able to get into the papillary dermis. We don't want to go higher because we don't want it to go into the reticular dermis. So one of the things that the hydrogen peroxide does, it transforms an aggressive peel into a non-invasive skincare product. Again, just let that set in. It transformed an aggressive peel into a non-invasive product. So this does not cause frosting as a typical TCA peel. So it combines the effects of high concentrated TCA and low concentration hydrogen peroxide, and it provides a deep hydration and regeneration of the skin at deep layers of the skin. So we're able to get into the papillary dermis, where we see all the things that we're looking for to cause tissue regeneration. So the label indications are for skin beautifying of the face, body, hands, and chest, for skin beautifying in case of scars and stretch marks, and for promoting attractiveness of the face, body, hands, and chest. This is it would be in the world of a cosmeceutical type of skincare routine that we use here in the US. It's simple for the professional and it's easy for the consumer or the customer or the client. It's non-injectable, there is no pain, there is no downtime. You hear from a patient that they peel for a couple days, very non-bothersome. It does not affect anybody's social life. It's non-photosensitizing. It is about a 20-minute in-office procedure to start, and it provides an immediate and palpable firming and visible glow of the skin. It is absolutely mind-boggling that my patients leave the office, that they actually report back that their skin felt better when they left the office, and they can't see like the frosting and other problems that we get with higher concentration TCA peels. So again, we have a unique method of application for this in a skincare routine where they have a prep for the skin. It's a balanced preparation so it enables this, we don't get excessive exfoliation. Step 2 is so that's called P-solution. Then we have a step 2, which is putting on the PRX-T33. It penetrates the papillary dermis and shows immediate visible improvement. And then they have 2 take-home products, a step 3 and a step 4, skincare creams designed for balanced lipid restoration and skin moisturization. And step 4, again, providing deep hydration and enhancing the effect of PRX-T3. The application is through a massaging technique. So the massage has to be performed directly by hand with a nitrile glove or with a specific rubber tip brush covered by the glove. So again, we don't want to have any concerns or problems with the person applying it. So you see this on the left. Again, there's an active at-home skincare routine that the patients will go home with. The home care after we do the peeling in our office, it restores the skin, and it completes and maintains the transformation of the skin and extends the results. So again, look at the difference here after 5, and we do this weekly. So it's weekly treatments, but you see the skin texture and tone improve, but the tightness improves. So they're getting a tightness to the skin that is very impressive. And when you look through the Visia analysis here, you see that the pores are improved. Everything about the Visia is improved. This is the brown spots. These are the wrinkles. Really nice, really good clinical results. Look at this improvement that you can get off the face with, again, this is after the first application of the peeling agent. Again, you see here. So depressed atrophic scars and stretch marks, people have used this, various scars, various things. But you see here, somebody who has some scars on the face, and they had a lot of this treatments at home and the office, and you see these results. Another scar here, 10 treatments and another 10 treatments to get these kind of results. Stretch marks improve. This is 6 weekly sessions with this. And again, if you look at Antira measurements, you see the improvement in the scar depth, the width of the scar, and the overall dimension improves dramatically when you do the PRX-T33. So thank you for letting me share this with you. It's a unique, interesting product. Thank you very much.